Hello, everyone. It's Dr. Durst with Revitalize MD, and we're going to talk about the PDO face thread lift today. So if you don't know what a PDO thread is, then we did do a previous video that talks about thread types. And PDO is one of the many thread types or materials, and that's the one that we use, and it's the most commonly used thread. So what we're going to do is now talk about that thread and how we use that to do a non-surgical facelift in the office, no downtime. It's actually could be a lunchtime procedure and you could go back to work. And we're going to show you how that's done with lots of videos that you can see of the actual procedure. But we're also going to talk about the PDO thread facelift. Threads are hot. And we've been doing them since 1990, but basically over time, we have just found that they work in a fabulous way to get you the lift and immediate results, but then also stimulate collagen elastin. So lots of studies that show collagen elastin form. So not only do you get the immediate results, but you also get better results at 3, 6, 9 months. And again, it's not impeding movement. It acts like a solid filler, but it's also regenerative. So you're basically stimulating collagen, but not only collagen, but elastin and collagen type 1, which is the collagen we want. And it basically is going to further lift over time. So you get those immediate results, but you get better results with time. And that is not very common with a lot of the aesthetic procedures that we do, that we actually are going to get improved results at 3, 6, and 9 months. But this continues to get better. So there are different types of threads, and not all threads are alike. And we did do a previous video that talks about those, but basically they're not all alike. It depends. You need to trust and find a provider or a business or physician that actually has done the research for you using FDA products, using the right materials, basically using the right type of thread, whether it be a lift or a smooth to stimulate collagen and elastin, and is skilled in placing those threads as well. The PDO thread, which is the most common thread we use, it is going to basically absorb in about 6 months. Well, it depends, 3 to 6 months, depending on whether you're using a lifting thread, which is thicker, and that usually has a barb or a mold on it. And so that's going to absorb about 6 months. And then you're going to continue to get results in stimulation of collagen elastin up to 12 months, really potentially up to 24, but we're usually repeating a thread lift at about 12 months. And again, there's different materials you use. PDO is the one we use. There's different types of threads we use. So if we looked at them, you'll hear, and there's some TV shows, and even Netflix has a show on aesthetic procedures, and they'll talk about sugar threads or mono threads. And those are basically what I consider smooth threads. And so they don't do anything immediately, but we can add those to a facial thread lift with PDO thread. So we're using a barb or a molded thread to actually lift. And we're going to talk about that procedure. And then we can add some smooth threads in to further stimulate collagen elastin. Say if we have some laugh lines or if we have a nasolabial fold, we can put some twist threads in there to pop that out and stimulate collagen elastin. And what are the big concerns with the face? And that's what we're going to talk about today is the PDO facial thread lift. So what are our big areas of concern? Nasolabial folds are a huge area of concern for women. And then the jowling area or marionette line. So if we can actually pull back, and again, we can pull back with filler or volume replacement in a cheek. So if we have a nasolabial fold, but we don't have any cheek left, we can actually lift up on the cheek and even define that cheekbone better. And so therefore we're getting a lift already, but then we add a thread to it. So again, it's not going to replace volume that's lost. And that's why we usually are using these in combination with filler in cheek if we need it. And then we put threads, or if you need a better defined jaw, we can define the jaw with filler, but we can also lift with threads. And that's what we're talking about here is using a molded or a barbed, or it could be considered a cog thread to actually lift tissue. And so these are the ones we're talking about right here where they have a little barb on it. And those are the ones we're talking about when we're actually lifting. And if I actually would be able to show you a little closer up. See if I can do that here for you. You can actually see where the barbs are. And so that barb is going to grab onto the tissue, and that's going to lift and give you the immediate effect. But then the whole thread is going to stimulate collagen and elastin, and that is going to give you improved skin thickness over time, 3, 6, 9 months. So basically, these threads are going to lift and they're going to build collagen elastin. So I'm going to show you just at least one thing that talks about this. So PDO threads and PLLA threads are two very commonly used threads. So this one here and this one here. And so you'll see increased. This is again at 1 week and then at 8 weeks. And you're just going to basically see more intense highlighted green here. But this is the important thing. If you look over here at 1 week, again, they're about equal, those two, PDO and PLLA. At 4 and 8 weeks, this is the PDO and that's higher. And this is the PDO and it's higher than everything else. So the bottom line is this is the PDO that we choose to use. And then again, we'll use a barbed for lifting and a smooth to basically stimulate some collagen elastin in areas that we need a little bit further help with that. You need a skilled provider because again, we need to make sure that the depth is right for these placements, because if you go too deep, that can be an issue. So definitely you want a skilled provider. You want to make sure you're at the right depth. And when we look at this is what we mean by that. So this is basically a thread going in. So say this is a barbed thread and we're lifting this tissue and it's the face. Basically, it doesn't have a needle at the end. It has a cannula, which is not as painful. So basically we can numb the site, and we're going to kind of show that on a video where we're going to numb the site and then we're going to numb the track. So what I want you to keep in mind is this track that we're talking about. And we want to be in the dermis, because if we start to get in the subcutaneous tissue, then that's where we get arteries and we can get veins and we can get nerves and we can get into issues with the thread placement. So you want to make sure you're in skilled hands and we're going intradermally with these threads. And we're going to get the lift that we need, because also if we go into the subcutaneous tissue, we're not going to quite grab onto and get the lift that we want. Even if you look a little bit further at the skin, if you end up looking, the epidermis is very thin, a sheet of paper. The dermis is thicker, but when we get down to the subcutaneous area, which is basically anything below this, then basically you have arteries, nerves, and veins, and you don't want to get into that. So we want to be in this level where we can actually build and stimulate collagen and elastin with it. And then we're going to talk about that with procedures with the face. You can do it anywhere, depending on where we want to treat. We use different types of threads, but basically we're going to talk about the face today. And so with the face, we can actually get all kinds of different threads with that, or vectors, what we consider vectors. And that's a vector of a lift. So what's our big concern is nasolabial folds, right? So with the face, we have a nasolabial fold in here, and people do not like that. So if we have volume loss in the cheek, by all means, we want to take that volume, replace it with filler, and then lift. But we can also do that same vector with a thread, and they work very well together. And so we would do maybe a vector here. We can actually do another vector here if we wanted to address the nasolabial fold. Or sometimes we might bring that vector down to the marionette line, and then from the marionette line to the angle of the jaw where this is more of a Z line. Otherwise, we might do a couple over the nasolabial fold, a couple down here for the marionettes. Because again, the jawline, which is in this area, and the marionette line right about here are the other areas of concern. So if we're to look at areas that we do not like, it's nasolabial fold, and it's the marionette lines, which are down here. And again, we want to lift all of that up, right? And that's what we're going to do with threads. And then if there's some volume loss, we can actually add filler for volume loss too. So I just want you to know that that's what we're going to talk about now. We're going to look at a procedure that talks about the face and how we can lift it. So basically, when we're doing a thread lift, you're going to get a full assessment and we're going to talk to you. It's an aesthetic consultation that we'll do with all of our patients. And we basically are assessing them to see, what are their needs and what are their desires? What are your desires? What would you like to see improved? And then from there, we're going to talk about everything. So if we're over 40, most of the time we want some firming or lifting. So we're going to talk about different ways to get the results you want. Sometimes it's different modalities that we tie together. And threads is one of those that we're using on almost every patient. And actually, we're not even usually approaching the patients about it for the first time. They've already heard about it because patients love it. Women love threadless. They love threads. And the one issue is it is addictive. So once you get it, you want more of it. So we could be talking about firming and lifting, which is sometimes a laser, maybe a 4D. And again, it could be a volume loss, which would be another thing that we talk about, or it could be more of what I consider a finishing or resurfacing, which we don't talk enough about. So we'll do a full assessment to decide what's right for you and what your desires are. And then again, you'll know what we think we need to get there. We discuss the different options, what you're willing to do, what you're comfortable with. You'll know, pricing of all those different procedures, and then you can decide and prioritize as well. So we formulate a plan with you. And then if we're actually doing the face, then we're going to go ahead and proceed with whatever's next. So if it's threads or if it's a laser first, or if it's Morpheus for a lift or Forma. But when we're doing the threads, we're going to talk you through the procedure. You're basically going to know what you're going to go through even before we start. And then you come in for a whole separate appointment, and that's your thread facelift appointment. When you walk in, you're going to basically be put in a room, and they're going to, again, get before pictures, and we'll do some after the procedure. But basically, we will put a little bit of topical on while we're getting the threads out and getting everything set up. Usually the setup is probably more time consuming than actually placing the threads, because we got to get the right threads. We got to make sure that we're all prepared to do it. Then once we have you ready to go, there's always an entry point that we're going to do for a thread. And again, if we're looking at vectors, so frequently my vectors will be, again, one over the nasolabial fold, one down here for the marionette line, and then one from the jaw to the marionette line. So there's going to be an entry point up here, an entry point down here. And then we're going to basically numb that entry point. And then we use a needle to actually make the entry point. And then once we get the entry point, I'm going to take a cannula with some lidocaine in it. And again, you've already been numbed at the entry point of where I'm doing the cannula thread lift, but I'm going to take a cannula just with lidocaine, and I'm going to numb the track first. So you already have some numbing of the track, and then we're going to go ahead and place the thread through that track. And usually by then, you're not feeling any of it. And again, some of the videos are worse than actually having the procedure done. That's why we'd like you to watch some of our videos so you can see how comfortable the patients are with these procedures. Then we will go and we will take the thread and the cannula, the thread's inside of a cannula. So we take it down, and again, we're in the intradermal, and we're going to take it all the way down to basically the nasolabial fold, and we're going to then pull back on that cannula. And when we do that, we're engaging the thread, and we're going to pull back all the way while we're engaging the thread, and then the thread stays in the tissue and the cannula comes out. And then we will go ahead and repeat that same exact thread and numbing first, of course, in the area of the marionette line, and then again from the angle of the jaw. And they could be different vectors, but some of the videos will allow you to see this vector layout with a beautiful lift of the nasolabial folds and the marionette lines, and it thins out the face, and actually can take years off a face. And sometimes people will know you've had something done, know things look different, but they're not sure what it is. It's what I consider a face transformation, because it looks amazing. You look younger, you look thinner. It looks like it's taken years off in just a quick in-office procedure. and usually about an hour to maybe 90 minutes. And again, you're numb on the track. We'll take it again down through the Marionette line. And as we pull back on the cannula, the thread is left in the intradermal region in the skin, and it's going to lift, engage that barb, and we're going to get lift. And then we actually, when we go to cut, probably get a lot more lift because we're pulling again, engaging the thread, and then we cut, and then the thread is left in the tissue for further stimulation and collagen and elastin, because it does both, which is awesome, and it does collagen 1. So you get an amazing transformation of the face. You get an in-office, non-surgical, no downtime, and very little in the way of discomfort. Again, we have options. We're always using lidocaine. Again, we're going to use lidocaine at the site, and we add some stuff to the lidocaine to make it very comfortable. We're going to numb the track. We're going to place the threads. You're going to actually not feel anything when we're placing the threads for the most part, outside of maybe, just some tugging and pulling and those threads engaging. And then you're going to see that you can actually leave, and frequently no bruising or swelling, although we do potentially have that possibility, because anytime you put a needle in a face, you can actually get some bleeding and bruising. So that's not uncommon that it could happen, but it's infrequent that we see it. And then basically you leave, and the only thing that you'll kind of be instructed is you may feel some tightening, some pulling, maybe a little catch here and there, because the barb will catch on to the tissue because it's pulling. But basically, we don't want you to do any exaggerated movements. We don't want you to work out too vigorously over the next 72 hours. We just don't want to stress anything in the face. And again, the face is from here up. We'll talk about brow in a separate video. We're going to talk about the neck in a separate video. We're going to talk about the nose in a separate video. So this is pretty much the face right now. And that's where, again, we're using that barb lifting thread, but we can actually use a smooth thread, which gives you nothing immediately in the way of a lift, but it stimulates collagen elastin over time. So if we have smile lines or we have some cheek, we want to either further lift up here, we can place it. If we have some smoker's lines or just lines around the mouth, not always related to smoking, or we have some volume loss or some thickening of the skin that we want to do down here in the chin area, we can place some smooth. Again, usually not an immediate effect, but often when we place them with the lifting threads, we do see some effect immediately with the smooth, because the transformation that happens in that 1 hour in the office, this is going to be over the next decade that people are going to get more comfortable using threads and want thread procedures. So that's why we want to get you as many videos as we can of the procedure, because you'll want to see them, feel comfortable with them, but you need to find a skilled provider that's been doing lots of thread treatments so that you know you're in the right hand, the right depth, the right thread, the right company of threads, and again, the right results for you. So again, if you want to hear anything more, then you just let us know specifically by commenting. Please like, subscribe, share with friends, let them know about threads and the facial thread treatments and the videos that you're going to see of these procedures. And then let us know your experience. If you've already had some thread treatments and you love them, or if you didn't, we want to hear more from you. And then again, if you want to hear anything else, just let me know, because I'm here to revitalize your look, your health, and your sex life. Thank you.